problem of seafarers. 1. Hand-arm vibration syndrome. Hand-to-hand vibration is one of the most dangerous hazards that many of seafarers face on the job. The main cause of this syndrome is used to power tools such as chipping machine, rust buster, needle guns, and handling grinders. Hand-arm vibration syndrome is caused by frequent and prolonged exposure to such power tools, and if not treated promptly, it can result in permanent disability. Tingling finger, numbness, blanching, and even pain in the arm wrist are common symptoms of hazard. Seafarers are more vulnerable to this disease due to the lack of awareness and improper guidelines on safety limits and usage or exposure to such tools and machineries, as well as other factors such as smoking, circulatory problems, and poor diet, among others. Number 2. Cardiovascular disease. Cardiovascular disease is commonly found in the seafaring community as in general pollution. Variation mortality studies have revealed that percentage of seafarers who die because of cardiovascular disease is because of a common factors which are combination of genes, age, smoking, and other social influenced by conditions of war such as stress, diet, lack of exercise, and etc. With minimum numbers of crew on board ship, multitasking, and lack of leisure and recreation facilities, high stress levels are prevalent among seafarers, which is the major cause for cardiovascular disease. Although medicines such as isotretinoin and glycerol internate for acute chest pain, and metoprolol tartrate, adrenaline, atropine for heart rhythm disorder are available on board. In case of severe heart stroke, which requires immediate medical assistance, evacuation to shore becomes difficult or sometimes impossible, posing great risk to lives and seafarers. Number 3. Leukemia. Cancer. Cancer is responsible for 1 out of every 8 deaths worldwide, and situation is getting worse. In the case of seafarers, there has also been a gradual increase of variation cancer cases. Lung cancer, renal cancer, leukemia, and lymphoma are most common cancer. Despite the removal substitution of occupational hazard, despite the removal or substitution benzides and benzenides on ship, new potential carcinogens such as rebelliums used on product tankers, cadmium, and lead have been introduced into workplace. Officer and crew working on both deck and the engine are susceptible to deadly disease or result in constant exposure to toxic substance. Personnel working on oil, chemical, and products tanker are heavily exposed to chemical, and risk of developing cancer such as brain cancer and leukemia is very high. Other factors include smoking, UV exposure, sleeping deprivation, and so on. Number 4. Pandemic and epidemic diseases. Seafarers are obligated to visit many ports in various parts of the world due to their nature of work are those exposed to various pandemic and epidemic diseases such as malaria, cholera, yellow fever, tuberculosis, and other seafarers are fully vaccinated immediately examined. But they are the risk of being exposed to sudden outbreak of new disease in the areas they visit. The recent outbreak of Ebola in the West African country is an example. In such situation, the best practice is to take all precautions possible to prevent the spread contagious diseases on board before docking. The master and crew should be informed of the diseases, and the people embarking the vessel and leaving the shore can be effectively controlled to prevent disease from spreading. Thank you, that's all.